HIV, or human immunodeficiency virus, is a virus that attacks the immune system of the body. The virus weakens the immune system by destroying white blood cells that fight infections. HIV is mostly spread through bodily fluids like blood, semen, vaginal fluids, and breast milk. Unprotected sexual contact, sharing needles or syringes with an infected person, and breastfeeding are the most common ways to spread the virus. HIV dates back to the early 1980s when PCP pneumonia and Kaposi sarcoma cancer were reported among gay men in Los Angeles and New York City. It wasn't known what caused these illnesses at the time, but in 1984, a team of researchers led by Dr. Robert Gallo discovered the virus that causes AIDS, acquired immunodeficiency syndrome, a kind of HIV infection. HIV has become a global epidemic since then, with 38 million people living with HIV worldwide as of 2021. HIV used to be a death sentence, but medical advances have made it possible for people with HIV to live long and healthy lives. Despite significant progress in HIV prevention and treatment, much work remains. HIV is still a big problem in many parts of the world, especially sub-Saharan Africa. People who inject drugs and men who have sex with men are at higher risk of HIV infection and have a harder time getting treatment. Millions of people are affected by HIV, affecting global health. There's still a lot of work to do to ensure that everyone has access to the tools and resources needed to prevent and treat HIV. Education, research, and advocacy are key to ending the HIV epidemic. Prevention of HIV is crucial to stopping the spread of the virus. There are several ways to prevent HIV infection, including safe sex practices. One of the most effective ways to prevent HIV infection is to practice safe sex. Using a condom during sexual activity can significantly reduce the risk of HIV transmission. Condoms should be used every time a person engages in sexual activity, including vaginal, anal, and oral sex. Needle exchange programs. Needle exchange programs provide clean needles and syringes to people who use injection drugs to reduce the risk of HIV transmission. Needle exchange programs can also provide education and resources on safe injection practices and drug treatment options. Testing and treatment. Getting tested for HIV and seeking treatment if positive can help prevent the spread of the virus. Individuals who are aware of their HIV status can take steps to reduce the risk of transmission, such as taking antiretroviral therapy, which can reduce the amount of virus in the body and reduce the risk of transmission to others. Male circumcision. Male circumcision has been shown to reduce the risk of HIV transmission among heterosexual men in areas with high rates of HIV transmission. Male circumcision can also reduce the risk of other sexually transmitted infections. Education and awareness. Education and awareness campaigns can help reduce stigma surrounding HIV and promote safe sex practices. These campaigns can also provide information on the importance of getting tested for HIV and seeking treatment if positive. It is important to note that while these prevention methods can significantly reduce the risk of HIV transmission, they are not 100% effective. Therefore, it is important to combine multiple prevention methods for the best protection against HIV. In addition to these prevention methods, there are also several HIV prevention medications and interventions that are currently being developed and tested. Some of these include vaginal rings. Vaginal rings containing antiretroviral medication are being developed to prevent HIV transmission during vaginal sex. These rings can be inserted into the vagina and provide sustained release of medication over time. Microbicides. Microbicides are substances that can be applied to the vagina or rectum to prevent HIV transmission during sex. Several microbicide candidates are currently being tested in clinical trials. Let's see how to prevent HIV infection using two primary effective methods. Number 1, pre-exposure prophylaxis. Pre-exposure prophylaxis is a medication that is taken daily to reduce the risk of HIV infection in individuals who are high risk of HIV transmission. PrEP has been shown to be highly effective in preventing HIV infection when taken consistently and as prescribed. Let's discuss PrEP in detail, including how it works, who should take it, and how to access it. How does PrEP work? PrEP works by preventing the HIV virus from taking hold and replicating in the body. The medication used for PrEP is a combination of two antiretroviral drugs, tenofovir and emtricitabine, which are also used in the treatment of HIV. When taken daily, These medications can prevent HIV from establishing a permanent infection in the body. Who should take PrEP? PrEP is recommended for individuals who are at high risk of HIV infection, including men who have sex with men, individuals who have sex with an HIV-positive partner, individuals who have multiple sexual partners or engage in high-risk sexual behavior, individuals who use injection drugs and share needles or syringes, individuals who have a history of sexually transmitted infections. PrEP is also recommended for individuals who are planning to conceive with an HIV-positive partner, as it can reduce the risk of HIV transmission during conception and pregnancy. How effective is PrEP? PrEP has been shown to be highly effective in preventing HIV infection when taken consistently and as prescribed. Clinical trials have demonstrated that PrEP can reduce the risk of HIV infection by up to 99% when taken daily. It is important to note that PrEP is not 100% effective and does not protect against other sexually transmitted infections. Therefore, it is important to combine PrEP with other prevention methods, such as condom use and regular testing for STI. How is PrEP accessed? PrEP is available by prescription from a healthcare provider. In the United States, PrEP is covered by most insurance plans, including Medicaid and Medicare. Assistance programs are also available for those who are uninsured or underinsured. It is important to discuss PrEP with a healthcare provider to determine if it is the right choice for an individual's specific situation. A healthcare provider will assess an individual's risk of HIV infection, conduct a medical evaluation, and provide guidance on how to take PrEP. How to take PrEP? PrEP is taken as a single pill once a day, ideally at the same time each day. PrEP should be taken consistently, even if an individual does not engage in sexual activity every day. If a dose is missed, it is important to take it as soon as possible and to resume regular dosing the following day. It is important to note that PrEP is not a morning after pill and should not be used as a substitute for emergency contraception. In addition, PrEP should not be shared with others, as it is prescribed based on an individual's specific medical history and risk factors. Side effects of PrEP. Like all medications, PrEP can have side effects. The most common side effects of PrEP include nausea, diarrhea, headache, weight loss, kidney problems. It is important to discuss any side effects with a healthcare provider, as they may indicate the need for a dosage adjustment or a change in medication. In general, pre-exposure prophylaxis is a highly effective HIV prevention method for individuals who are at high risk of HIV infection. PrEP works by preventing the HIV virus from taking hold and replicating in the body. Number 2. Post-exposure prophylaxis. Post-exposure prophylaxis is a medication that can be taken after a potential exposure to HIV to reduce the risk of HIV infection. PEP should be taken as soon as possible, ideally within 72 hours of exposure. Let's discuss PEP in detail, including how it works, who should take it, and how to access it. How does PEP work? PEP works by preventing the HIV virus from establishing a permanent infection in the body. The medication used for PEP is a combination of antiretroviral drugs, similar to those used for the treatment of HIV. When taken as prescribed, PEP can stop the virus from replicating in the body and prevent it from establishing a permanent infection. Who should take PEP? PEP is recommended for individuals who have been potentially exposed to HIV, including individuals who have had unprotected sex with a partner known to be HIV positive or of unknown HIV status, individuals who have shared needles or other injection equipment with someone known to be HIV positive or of unknown HIV status, healthcare workers who have been exposed to HIV through accidental needle sticks or other occupational exposure, individuals who have been sexually assaulted and may have been exposed to HIV. It is important to note that PEP should only be taken in emergency situations and is not a substitute for other HIV prevention methods, such as condom use in PrEP. How effective is PEP? PEP can reduce the risk of HIV infection by up to 80% when taken as prescribed within 72 hours of exposure. However, the effectiveness of PEP decreases the longer it is delayed after exposure. Therefore, it is important to seek medical attention as soon as possible after a potential exposure to HIV. How is PEP accessed? PEP is available by prescription from a healthcare provider. It is important to seek medical attention as soon as possible after a potential exposure to HIV, as PEP is most effective when started within 72 hours of exposure. In emergency situations, PEP may be available at an emergency department or urgent care center. It is important to discuss PEP with a healthcare provider to determine if it is the right choice for an individual's specific situation. A healthcare provider will conduct a medical evaluation, including HIV testing, and provide guidance on how to take PEP. How to take PEP. An antiretroviral drug combination called PEP is taken for a 28-day period. It is important to take PEP as prescribed and to complete the full course of medication, even if an individual does not experience any side effects. PEP shouldn't replace other HIV prevention methods and should only be taken in an emergency. Also, PEP may have side effects, so talk to your doctor if you have any. Side effects of PEP. Like all medications, PEP can have side effects. The most common side effects of PEP include nausea, vomiting, diarrhea, headaches, fatigue. It is important to discuss any side effects with a healthcare provider, as they may indicate the need for dosage adjustment or a change in medication. In general, post-exposure prophylaxis is a medication that can be taken after a potential exposure to HIV to reduce the risk of HIV infection. PEP works by preventing the HIV virus from establishing a permanent infection in the body. PEP is recommended for individuals who have been potentially exposed to HIV and should be taken as soon as possible after exposure. In a nutshell, HIV prevention is an important aspect of public health. While there is currently no cure for HIV, there are effective methods for preventing HIV transmission, including condom use, PrEP, and PEP. It is important for individuals to take responsibility for their own sexual health by practicing safe sex and accessing available prevention methods. Additionally, it is important for healthcare providers and public health organizations to continue to promote HIV prevention methods and increase access to prevention services, particularly for populations at highest risk for HIV transmission. Through continued education, outreach, and access to prevention methods, we can work towards reducing the transmission of HIV and ultimately ending the HIV epidemic.